Everybody here today. At this time, I'll call the Tuesday, April 25th, 2023 work session of the Harnett County Board of Commissioners to order. I will also ask Commissioner Lewis Weatherspoon to lead us in the Pledge of Allegiance and invocation.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing. Most gracious Heavenly Father, we thank you, Lord, for another day you've given us. Lord, we thank you for this crowd of constituents that we have here today, Lord, as we go about conducting the business of Harnett County. Lord, we ask you to be with us, guide us, and direct us, and may everything that we do be pleasing in your sight. These things we ask in Christ's name. Amen.
Thank you, sir. Right. This started today. We have a Sandhills program update and budget request. If Miss Victoria Witt would like to come up. And Anthony.
Good morning. I'm Victoria Witt. I'm the CEO of Sandhills Center. I appreciate you allowing us to come today. I do have another face with me today, and this is
He's
he
hiding.
does that to me all the time. Anthony Ward, who is the Deputy Director at Sandhills Center. I've asked him to come along today with me. As you know, my official reason for being here today is to present the Sandhills Center request for county general funding and to give you a brief program update. Before I get started, I want to thank you and recognize this Board of Commissioners appointment of Commissioner Nichol to the Sandhills Center Board. Commissioner Nichol is a faithful attender of board meetings and has also joined our finance committee. So we really appreciate his support and the support of this board. Also, his predecessor, Commissioner Weatherspoon, served on the board, and before that, Commissioner McCoy. So driving down here today, I was thinking that Harnett County has really given the board at Sandhills Center the support not only of the board, but your leadership, by having your leadership actually serve on our board. So we really appreciate the time that you have spent on that and support. Also, I want to make the announcement, I think many people already know, but after 43 years at Sandhills Center, I have made the decision to retire. So I will be retiring June 30th of this year. It has been a pleasure to work with Harnett County and to serve Sandhills Center as the CEO for 13 of those 43 years. Also, I would like to make the announcement that at our board meeting, the board unanimously appointed Anthony Ward as the new CEO of Sandhills Center effective July 1st. I think transition and smooth transition is going to be key in keeping things moving. You know, there's a lot going on in behavioral health, there always is, and I'm so pleased that the board made that decision. So I'm going to ask Anthony to tell you, I think most of you or many of you know Anthony, but I'm going to ask him to say a few words of introduction.
Thank you, Victoria. Thank you, Mr. Chairman. Commissioners, good to be with you this morning. As Victoria said, I'm Anthony Ward. I've had the pleasure of working with Victoria and Sandhills Center for the past 11 years as Deputy Director and Chief Operating Officer. Prior to that, I worked with Guilford County as a single county program as the CEO and worked with Victoria on the merger of bringing Guilford County into Sandhills Center. So my experience with behavioral health goes back to 2004 time frame. By education, I'm a social worker as well as an MBA. So finance, clinical services, I can have either of those conversations with you. So if you have constituent concerns, if you have questions about the behavioral health system moving forward, feel free to reach out. I'll look forward to talking with you. Thank you.
Okay, now to the official reason that we're here. Our board met on March the 14th, and for the 19th year in a row, made the decision not to request any additional funding from any of our counties. So our budget request to you for county general budget allocation is the same amount as it has been all these years, and that is $199,679. I'll remind you that all of that money stays right here in Harnett County in support of the Daymart program, their crisis services, and their outpatient services. We at Sand Hills have been able to hold the line, so to speak, and not have to request any additional funding of our counties because we find that once we took over the management of Medicaid for behavioral health, we were able to make those dollars stretch to assure that folks were getting the services they need. So we've been able to hold the county allocation at a flat level. Also, we have been very pleased to be able to reinvest some of the Medicaid dollars into projects here in Harnett County. A few of those projects are the Veterans Treatment Court, which we have supported for the last few years, Good Hope Hospital, who is also presenting this morning, and Wake Enterprises, who provides a day activity program for folks here in Harnett County. So not only have we been able to hold the line, so to speak, on county dollars, we've also been able to reinvest dollars back into the community. So that is the request. I hope that when you get into your budget cycles, which I'm sure you are now, you will look favorably on continuing this allocation to Sand Hill Center. I'll be glad to answer any questions about the allocation, and then I'm going to ask Anthony to give a brief program update on some things that are happening here in Harnett County. I'll be glad to answer any questions you have about the allocation request.
Thank you, Ms. Witt. Any questions? Comments?
I don't, Chairman, Mr. Chairman, I really don't have any questions. I would at some point, Ms. Witt, and of course, maybe after your time, but at some time, if we could maybe have a little bit more information regarding Wake Enterprises and what they do for our county, how many of our citizens they're able to serve, what kind of needs are we meeting the needs that our county has, and that area is really the underlying cause of this request, I guess.
Right, okay. Absolutely. I will be glad to, I don't have it with me now, but I'll be glad to work with your county manager in the next day or two to provide you that, because I'll remind you that all of those dollars, the Veterans Court, Good Hope Hospital, and Wake Enterprises go through an approval process of you to approve it. So if you see at any time any of these reinvestment dollars are not where you want them to be directed, we will gladly make a change. So I will get with your county manager next couple of days and kind of flesh out the Wake Enterprise.
Thank you.
Anthony?
Any other questions?
Okay, so on to the program update. There's several things that are in your packet. We're not going to take you through each one of those, but in the packet there is an overview of some of the activities that we're working on here in Harnett County. We have several staff who are going through various projects and committees so that we can stay closely tuned in. There's the quarterly report, there's an annual report that's included. But I do want to spend some time on this packet that's the screenshot that is up now. This is an overview of services that are being offered in Harnett County through Sand Hill Center dollars. So there's several things I want to draw your attention to. The first is in the top left corner, which is the number of members served by calendar year. Particularly what you see for 2018, 19, and 20 was the number was holding fairly steady around 4,000 individuals. You see a decrease in 2021 and a more significant decrease in 2022. The reason for that decrease is because the state changed how behavioral health services are managed for North Carolina. July 1st of 2021 marked the introduction of standard plans into the behavioral health array. So now 5 commercial plans that are the standard plans for North Carolina manage those individuals who have a more mild to moderate behavioral health need, while we manage those individuals that have a more significant behavioral health need. The standard plans are managing the physical health for the individuals as well as their behavioral health. We manage the behavioral health for our members, and then as tailored plan comes down the road later this year, we'll manage the physical health for them as well. So those individuals are likely still being served. We don't pay the claim for them, so I can't show them on our report. That's what's leading to that decrease. Moving on around clockwise, you see the investment of services here in Harnett County last year at just under nearly $28 million of services. The largest of those is Innovations. Innovations is a separate waiver within our larger 1915 BC waiver that we manage. You see Psychiatric Residential Treatment Facility and Behavioral Health Long-Term Residential. That's when out-of-home placements are necessary for children. You also see inpatient hospitalization on the list and outpatient. Moving on around, you see members served last calendar year. The primary diagnosis of individuals served last year, 43%, were adult mental health, followed by child mental health at 24%. And then you see adult substance use at 19%. Then finally, you see the providers that were serving Harnett County individuals last year. 297 providers were part of our network serving local members. The largest of those was Daymark. Daymark, of course, provides our crisis services, the walk-in crisis services. They have the largest array of dollars with us. They have the local county dollars. They have state dollars for indigent folks without insurance, and then they have Medicaid dollars as well. Those are all funding sources through us, but they also contract with standard plans. They contract with private insurance, so it's a good opportunity to direct individuals who are seeking services to Daymark to begin the routing process. Then you see outpatient services, you see Harnett Health and inpatient services, you see Morse Clinic of Dunn. Morse Clinic of Dunn largely offers medication-assisted treatment with us, which is a big component of the opioid service array that is available here locally. So I'll stop with that, but you have the other information that's in your packet. Certainly if you have any questions about what we've talked about or any information or questions about anything else in your packet, I'll be glad to address them.
Thank you, sir. Any other questions? Comments? Thank you very much. Your presentation was phenomenal, as always.
Thank you.
Thank you. Would it be the pleasure of the board? Do we do this budget request now, or are we going to work
It'll
on
be
this?
part of the main budget
Okay.
presentation. It'll be included in the budget as we approve the entire overall budget.
Sounds good. All right. Moving on. Good Hope Behavioral Hospital update. Mark, you want to come up and kick it off?
Sure. First, I'd like to just thank all of you commissioners and the county leadership and the dedication and your devotion to providing mental health services to our citizens here in this county and in our communities. Just want to express our deep gratitude for each and every one of y'all. Just to give you a little update about Good Hope Hospital. So in about 6 weeks, we will be up and running with 32 beds. So I don't know if everyone knows about Good Hope Hospital. We're an inpatient behavioral health treatment facility. It's a freestanding hospital. We address patients that have severe mental health crisis, and our job is to stabilize them and make sure that they have appropriate outpatient follow-up and making sure that they're getting connected in the community. And so we've been primarily mental health for the last 10 years and so have served an incredible number of individuals here in this county and in the surrounding area. We're also looking to expand services into the outpatient type setting and still working with our psychiatrists and providing that. We also have some space that we are excited about and looking forward to doing something with as well. So as the need of mental health services ever increases and we are are here to step up and provide those services to much needed services to our county, and look forward to being an example of mental health services to the state and the country. So with that being said, that's a little update about Good Hope Hospital and the services we provide, and just express our gratitude to you guys. So thank you for this time.
Thank you very much.
Anybody have any questions? Anybody like to?
Questions, comments? I will say I'm going to keep you up at the podium because
Okay.
next on the list we have a proclamation recognizing Mental Health Awareness Month. If I can have the other commissioners join me up front, and if there are any other members with you that would like to come up as well. Okay, so a proclamation recognizing Mental Health Awareness Month 2023, whereas since 1949, May has been observed as Mental Health Awareness Month to increase awareness of the importance of mental health and its impact on physical, emotional, and mental well-being of children, adults, families, and communities. And whereas nearly 1 in 5 adults in North Carolina live with a mental health condition, and whereas suicide is the second leading cause of death for young in North Carolina ages 10 to 18, and the third leading cause of death for those ages 19 to 34. And whereas stigma and the resulting discrimination is a primary obstacle to early identification and effective treatment of individuals with mental illness and their ability to recover to lead full, productive lives. And whereas less than half of adults in North Carolina struggling with mental illness receive needed and necessary treatment. And whereas with early and effective interventions, those individuals with mental health conditions can recover and lead full, productive lives. And whereas promoting mental health and wellness leads to higher overall productivity, better educational outcomes, lower crime rates, stronger economies, and improved quality of life. And whereas through public education, working together to raise awareness and promoting support prevention efforts, everyone can reduce the stigma and assist in the improvement of the lives of individuals and families affected by mental illness. Now therefore, the Harnett County Board of Commissioners does hereby proclaim the month of May 2023 as Mental Health Awareness Month in Harnett County. The Board of Commissioners also calls upon citizens, government agencies, public and private institutions, businesses, and schools to recommit the community to increasing awareness and understanding of mental illness, reducing the stigma and discrimination, and promoting appropriate and accessible services for all people with mental illness, declared this 25th day of April 2023. Sir, thank you. Is this you?
Thank you all. Just want to also let everyone know, May 17th we'll be holding a little celebration at Good Hope Hospital about recognizing mental health awareness month as well. So May 17th at 10 o'clock. Welcome everyone. Anybody that wants to come?
Thank you, man.
Oh, thank you, ma'am.
Okay. Now we will discuss system development fees. Mr. Steve Ward.
Thank you, Mr. Chairman, members of the board, good morning. Every 5 years, or a minimum of 5 years, the state of North Carolina makes us do a system development fee analysis. We have to post that on our website for 45 days and allow the public to make comments on that analysis. We don't address the comments. The board doesn't address the comments. The staff doesn't address the comments. The preparer or the person who conducts the analysis, the comments are addressed to them in case they need to make any changes in the formula if those comments are relative to the formula. So we're in the process of doing that right now. So I wanted to go over briefly what the draft shows that's on our website, and Just briefly go over that to give you an idea of where we're at in the process and what comes next. So system development fees are generally one-time charges implemented to recover the costs associated with capital investments made by a utility system to make service available to future users of the system. It's pretty customary for practice for water and wastewater utilities to implement these charges to establish a supplemental source of funding for future capital projects. We've had system development fees, we used to call them capacity fees, since about 2000, early 2000s. We've had them for a very long time, as most utilities have. This practice helps to mitigate the need for existing customers to pay for system expansions entirely through increased user rates. So in other words, the thought process behind system development fees is to allow growth to pay for growth. So you're requesting to build a subdivision or put in more and more water and sewer taps. You know, you're taking a piece of our system, so the existing user base shouldn't have to pay for that increase if we have to increase the plant size or increase the line sizes, et cetera, et cetera. So it's pretty self-explanatory. And so I'd just like to call your attention to that. I'm not going to go into a lot of the legal things that happened, but I will mention briefly about 6 years ago now, the General Assembly put this process into place where they make utilities establish a formula and do an analysis based on their assets, their debt, the capital contributions to the system. So it gets pretty complicated on how to do the formula. We contracted with Willdan Services out of Orlando, Florida, through Withers and Ravenel of Raleigh, a local engineering firm, to do our analysis this year. 5 years ago, like I said, you have to do this at a minimum of every 5 years, but you could do it annually if you wanted to. Most utilities like us wait and do it every 5 years to determine what the fees should be. And that's what this analysis does. It determines the maximum that the board could charge or put in place for these fees. It's really up to us or you to decide what the fee should be. It just can't go over that ceiling, in other words. So we currently impose SDFs on new customers requiring water and wastewater utility service, and those fees are $2,000, an equivalent residential unit. I know that's a fancy term, but that means basically what a house would use, that amount. So if you're going to build a building big enough to compare to 10 houses, you would pay the fee times 10 is what you would pay. If it's just a single house, you would pay that single rate for the house or the equivalent residential unit. The same goes for sewer. So our current rate is $2,000 for water and it's $2,500 for sewer. Again, it's been that way for 5 years. If you looked around, our fees are really low compared to a lot of other units, but it's not really an ideal time to compare rates because everybody's going through this same analysis. So everybody's rate's going to change depending on how the analysis comes out now. So that's why that's not part of the study. And the analysis here briefly gives us an idea of what we came up with or what Willdan came up with. The proposed rates are $3,850 for water and $4,320 for sewer. So again, that is the max that we can charge per lot. And so after looking at this and studying this analysis, you know, our departmental recommendation is to be $3,000 for water, which is $850 underneath the maximum, and $4,000 for sewer, which is $320 under the maximum going forward. That's entirely up to you what you want to charge. I would remind the board that there's a lot of growth coming that we've got to provide capacity for. So like all the sewer growth that's going to happen and water growth north of the river, these funds go into a capital reserve fund. So we can't use system development fees by law to pay for operating expenses. Can't pay salaries with them, can't pay for gas, can't pay for materials, etc. They have to be set aside, and Kimberly set up a capital reserve fund. All these fees are put in the reserve fund and can be used for things like expanding plants, building new lines, building new lift stations, building new pump stations for water. That's what they're for, and have to be used for that. So again, we've got a lot of growth coming, and we've got to be able to pay to accommodate that growth. So that's our proposal. Again, $3,000 for water, $4,000 for sewer. Now, part of the thing that's different about system development fees it's based on what size meter you want to use. So that $3,000 water rate is based on a 3/4 inch meter, standard size that 99% of people have for their house. But if you want a larger size meter, then you can get more out of the system. The system has to give you more, for example. So if you want a 1-inch meter, it'll do 2.5 times what a 3/4 inch meter will do. So that rate is the max that's listed is $96.25 if you want a 1-inch meter. So my suggestion there, and departmental suggestion, is just stay at whatever the meter factor is. A 1 inch is 2.5. So if it's $3,000, or excuse me, if it's $3,000 for water, that would be $7,500 for water for a 1-inch meter. A 1.5 inch meter, which you really don't have to worry about. Most people don't make 1.5 inch meters. We go from 1 inch to 2 inch. But let's say a commercial business wanted a 2-inch meter. That's 8 times. They can use 8 times the water that your house can use because of that size of that meter. So that would then be $24,000 is the recommendation for that. So, and that's how everybody sort of does this thing when they determine what these fees should be. And again, it depends on how much capacity you want going forward. That's not unusual. For example, if a McDonald's comes in and wants a 2-inch meter, and they want that much equivalent sewer, then their fee would be $56,000 for system development fees. They pay, slightly lower than that now because our rate's a little bit lower. But again, we've got to be able to accommodate this going forward, and this capacity to build it, as we're going to see with this North Harnett wastewater treatment plant expansion, is only getting more expensive. In fact, just briefly touching on that plant, our original cost estimate back in November of 21 was $63 million. That's gone up to $75 million roughly now for that same project. So the state required us, as part of submitting the final plans to them, to give an updated estimate, and that's the latest engineering estimate. It's up to about $75 million to build that plant at that 9 million gallon per day upgrade. So that's just an example. So everything's getting more expensive. Again, this is what is recommended from Wildan for the study. Going forward, we put this up on our website for the 45-day comment period. We'll be through with that process roughly the middle of May. Then we have to have a public hearing scheduled for the same date that the budget would be. That public hearing, the first meeting in June, when you're scheduled to adopt the budget. In fact, this would be adopted with the budget and would be put in the budget document that's shown on the website and that sort of thing. So if anybody wanted to see what the fees were, we keep it on our website anyway. So if anybody has any questions, they can go directly to the analysis and see what's going on there. So that's sort of where we are. So if you've got any questions for me, I'll be glad to try to answer them. In the meeting in June, when we have the public hearing, I'll have a representative from Wheeldan here in case anybody has any really technical questions, but I don't anticipate those. We haven't had any comments so far that I'm aware of, but I'll be glad to answer any questions you may have.
Thank you, sir. Comments, questions?
I do have a couple of questions. Mr. Ward, I think you may have already answered one of those. I was wondering if this 5-year review was a snapshot in time, or if we could include anticipated debt service for what we're going to see with our expansion with our sewer plant.
It is a snapshot in time.
Okay.
And I can be more technical. There's actually 3 different methods that you can use. We use the simplified method, which is called the buy-in method. And that's where you take your existing assets minus any existing debt and capital contributions, and you take the available capacity you have, divide that into it, and you come up with this rate. So that's what they've done. The best part about the buy-in method is you can use the SDFs for any future capital needs. Makes it simple. The other method is called the incremental method, where you do kind of like you suggested, and you are able to include your capital improvement projects that you've got planned in your valuation of your assets, but then you're limited by what you can spend the money on. You can only spend the money on those certain things. So, for example, if we need to make improvements in some part of our system, we can do that with SDF fees now, as long as it's part of a capital or any kind of capital improvement. We can do that. We don't have to have it set aside and planned out in the future and included in our formula base. So we've got a lot more freedom within the buy-in method. A lot of people use the incremental method because they don't have the assets we do. I mean, we've got, even after depreciation, our assets are well above $500 million, which is a lot more than a smaller town utility would have to base their fees on. So a lot of people use the incremental method because it allows them to get their fee based on what they want to based on what they want to accomplish going forward. The other method is the combined method, where you kind of combine them, the two. So I hope I answered your question there going forward, but it still gives us a lot of flexibility, and we can still use it on any future projects going forward. And the other thing that's really working well for us is our assets keep increasing and our debt keeps going down as a percentage of that. We haven't borrowed any money in 10, 12 years, and we've continued to build projects. So that's really been helpful in keeping the SDFs up, as well as making us more healthy overall financially. So I hope I answered your question.
If I could follow up on that then.
Yes.
So if, as you mentioned, anticipated increases in capital needs going forward, which we all see every day.
Sure.
At the end of that sewer expansion and whatever indebtedness we end up having to carry,
Sure.
We could always go back if we saw the need, and within that 5-year span, if it's after 2 years, 3 years, whatever, and redo that process if we saw the need was there to do that.
Absolutely.
Okay, thank you.
5 years is the minimum, but we could, pay for another analysis, and the board could address this very thing again next year and even change the formula if we wanted to, on how we do that going forward.
Thank you.
Mm-hmm.
Further question?
And the other question I have, just for information, historically, I guess, 5 years ago when the study was done and the fee was set at what it currently is, was that at the maximum allowed, or was that less than?
Oh, it was way less.
Way less. Okay.
The water fee, I think the original analysis in 2018 was somewhere around $7,000 was the maximum we could do. and we did 2,000. And the maximum sewer was roughly the same it is now, and we did 2,500. So we've always been lower, and kind of the thought process about that, quite frankly, is remember these fees aren't only for developers.
Right.
They're for grandma and grandpa who want to build a house too on their land. So if they want a water tap, it's $3,000 just this system development fee, and then another $1,000 to get the tap. So they would pay roughly $4,000. I know that's still less than a well, but just something to consider. We can't distinguish between what we charge development and what we charge the normal user out here. It's all the same. The only thing that makes any difference is the size of the meter.
I think you just answered
Thanks.
my question.
Right.
I don't have to answer that question.
Right. You really have
I
to
got a lot of
balance.
calls. I got a lot of calls on that. So you just answered my question. Thank you.
Uh-huh.
And Mr. Ward, you might want to point out that unlike some local municipalities where you pay more SDF than what we charge, you also, in that municipality, have to go hire a plumber to come do your tap. Whereas with HRW, you pay us the fee and we do the tap for you.
I mean, that's a good point. I mean, when you pay us for a tap, we're actually doing all the work and putting the tap in. So that's a good point. Thank you.
I got one question I want to ask you, a little bit off the subject. When you go back out to the homeowner's home to read the meters, especially for those that have these new meters that we are putting down now, is there a fee for that?
Well, we don't have to go back out to the home.
I mean,
because
if the homeowner requests that.
if they request it and we go out and we determine that there's nothing wrong with the meter and the reading is correct, then we charge them a service fee for driving out and coming back.
Okay, you answered my question.
Now, if something's wrong with the meter, there's no charge.
Okay.
And on that note, we're just about 80% complete with getting all the new meters out. So we were delayed about 6 months simply because we couldn't get anything because of supply chain issues. But that's resolved itself. We started again this month. In fact, April 1st, or first part of the month, we started. And so we're back on track there. That should be over with here by the end of the summer.
So you said 80%.
Correct.
Okay. And if I may ask, since we broached that subject, and how is that going with those meters that have been installed? Is everything working as you had hoped it would?
Oh, it's been great. It's absolutely been wonderful. So we have about 99.8% coverage with the meters we put out. And so it's worked really well. Like most things that you bid out, we didn't go for the lowball bid because we were concerned about the adequacy of the network system that's up on our tanks and how good the readings were, and these have been great so far.
Thank you.
Anything else? Thank you very much, sir.
Thank you.
Hey, next we'll have the Riverside Community Drainage Improvement Project update. Ms. Lynn Lambert.
Good morning, Commissioners. I wanted to provide you all with an update on our Riverside Drainage Improvement Project. As you all know, when we started this project, we really looked at it from the watershed as a whole, because this is not just a one or two landowner issue. This is truly a community-based watershed issue. And so our goal was to have efficient drainage, allowing for the water to exit this neighborhood using the current system in place. And in order to identify the areas where we really needed to focus our work, we worked with a third party called Wetland Solutions to have an assessment done. And that is what allowed us to identify the areas that we are having work performed on. Let's see. There we go. And so we have the 4 planned phases: the culvert improvements and drainage ditch cleanouts, the abandoned tire removal, long-term maintenance, and then potential for further study of some lost connectivity in these drainage areas within the tertiary or sort of backup drainage system that is there in place within the community. This picture that you see here is sort of a more close in shot of our study area and the neighborhood that we are looking at hoping to make improvements through this project. And I wanted to highlight in another project that our office has been involved in over the last couple years that I know you all have heard about, of our stream debris removal project. 3 miles of that project actually went through this same study area. So we have removed vegetative debris from the Upper Little River from Titan Roberts Road to the Cape Fear. Now within the Upper Little River, we actually did from the Lee County line all the way to the Cape Fear River. But 3 miles of that went through this study area. And I felt like that was important to point out because a lot of these drainage ways through the Riverside community wind up in the Upper Little River. And if the Upper Little River is not flowing efficiently, then it can then cause these smaller side creeks and drainage ways to back up with water. And so while it wasn't initially intended to be a part of this particular project, it certainly has an impact on this project and is connected. The other thing that I'd like to point out there is the Cape Fear River. Of course, the Upper Little River and the Cape Fear River come together right there in this community. The red flags that you see are our work areas that were identified by the Wetland Solutions Study. The flag that is closest to the Cape Fear River, I feel like that's important for us to point out. That is our location where we found that there was a large pile of tires that needed to be removed. And note that there is only one parcel of land between where this pile of tires is and the Cape Fear River. So water draining through this particular area of land is draining straight to the Cape Fear. And there is a drainage ditch, a decent sized drainage ditch that actually runs through that parcel of property there where that red flag is. Now this is the view of the issue as we found it. We were fortunate to be able to time it where we could do this project in the wintertime. As you can imagine, this is not somewhere that you would want to be in the summer because of the potential for snakes using this as a space to live. It's great snake habitat, it's great mosquito habitat. So this is actually the pathway into these tires. We did not put this pathway in. These tires were very intentionally placed a long time ago. I would say 40 plus years ago. These piles were in very strategic locations within this piece of property, and when we got the equipment in there and got to working, we actually discovered this gravel road that was put in. And these pictures, they really don't do these tire piles justice. It wasn't just one pile. We did not make these piles. We didn't have to scratch them up and create these piles. These piles were already there. This location is at the dead end of a state-maintained road. The road, the DOT right-of-way, continues through this parcel of land. So this is standing, this view in this picture is standing on the end of the pavement looking straight out into the DOT right-of-way. And so as you can see, whomever placed these tires here years ago in this wooded area utilized the DOT right-of-way to enter the property, and then there was a sort of a wall of tires built on either side of that pathway to allow them access to the rear of the property. This is another pile that was back closer to the rear of the property, and one of our staff members standing there, sort of a size comparison. He's not a little guy, and you can see how large that tire pile is. And so there were several very substantial piles. We removed 12 tractor trailer loads of abandoned tires from this location. All of these tires, being on this particular parcel, created several different issues for this community. One of the primary issues, if you look at abandoned tires in the environment as a whole, is the threat of fire and those old tires catching on fire. We all know that when rubber burns, that creates several different environmental issues. We found this just before we started work and had equipment on site at this location. There had been a couple rains, and so it had somewhat washed away. But this is a burn barrel that had gotten out of control and made its way. The fire had made its way very close to this pile of tires. And so if this had not been in a naturally wet area, we would have had a big environmental issue if that fire would have made it about 20 more feet. But luckily it was in a damp area and probably did extinguish itself. So I consider ourselves lucky that this large pile of tires did not catch on fire, but it was very obvious as to the source of where this fire came from. Another issue with abandoned tires in any area is that, of course, they hold water. And in this particular case, not only were they holding water, being a great home for snakes and an area for mosquitoes, they also were in the drainage ditch. And so the water that passed through this community as it made its way through this drainage area and to the Cape Fear River was running through this pile of tires. And that's certainly not what we want in terms of water quality in our river, in our local streams. And so this is a picture of one particular area where the tires were actually in the drainage ditch. Here's another example of how the tires were again in the drainage ditch. And as you can imagine, when we have heavy rains and these drainage ditches need to be flowing freely to allow the water to escape this community, these are a huge obstacle for that water trying to make its way through this drainage area. And so at this point, we have removed all of these tires. We have cleaned up the area. Somebody worked hard a long time ago. Every tire was cut. We actually found the machine buried in the middle of one of the piles of tires that was used to cut the machine. It was a large metal machine. And so we think this was a somewhat of a tire recycling or landfill type situation going on where they were cutting the tires, popping the rims out, and then selling the rims. So there was a lot of work that went into actually creating this pile of tires. But unfortunately, the location was not a wise choice for the community and has most likely been impeding the drainage of the community for a number of years. Some of these tires were so old that they were the small, narrow tires that would have been on, really old vehicles, 1950s and back. So it was kind of interesting to see the nature of some of the tires that we found. We were able to partner with Solid Waste in order to complete this portion of the project through a program that they have in partnership with the state for abandoned tire removal. And with those 12 loads, we have currently received the invoice for 6 of those loads, and right now we are right at $23,000 for the cost to remove these tires, and that is only for 6 loads of them, and that 6 loads equaled 90.53 tons of tires that we removed. And so it was no small task in getting this done, but all of them are removed, and we anticipate a second invoice, and we will be finished with that particular site location. The additional portion of the project our contractor has now moved on to, which includes the culvert and drainage ditch improvements. And so he is now working on replacing some culvert pipes in the community and cleaning out the drainage ditches, and hopefully the weather will cooperate. This work is very contingent on the weather and how much water is flowing through those ditches. When he leaves, my hope is to leave this property certainly better than what we found it. And so, I have really cautioned him if the area is too wet, we just need to wait until it is suitable for us to get in there and certainly not harm the property around these drainage areas, and leave it better than we found it. And so he is currently working on these particular areas, and with the weather, as long as we don't receive considerable amounts of rain over a several day period, he should be able to make great progress there. After we finish the drainage ditch and culvert replacements on these properties, we will then move into phase 3 of a long-term maintenance plan, and then into the potential of phase 4 for further research into that tertiary drainage that is, we believe, being interfered by a utility right away. And so that certainly is going to require much more research to see if there's anything done that can make improvements on that end of the study area. Any questions about where we are at this point with the project?
Excuse me, Commissioner McCoy, I have a few questions. Moving these ties clearly was an important part of this operation that you all, and I appreciate all that you've done. But I want to ask about these tires. This location for these tires, is it close to the Bun Level Irwin Road?
Yes, ma'am. It is off of Roosevelt Road, which is a turn off of Bun Level Irwin Road. It's a short dead-end road.
Okay, so these tires was pretty much backing water up. And would you say that they were backing the water up on the Bun Level Irwin Road there where all of those swamp-like areas were?
So as you travel down Bun Level Irwin Road, you can see standing water on both the right and left-hand side in certain places.
Mm-hmm.
Most likely the areas that you're thinking about there are the areas where we have identified where we think there are culverts actually missing under Bun Level Irwin Road. And DOT is not able to find those culverts either. We have reached out to DOT, and they are supposed to be taking this into further study as to whether or not they can place culverts underneath Bun Level Irwin Road to help that water more freely flow. If you look at the way that the drainage system was designed for that particular area, it shows that water is supposed to flow where Bun Level Irwin Road is, and so we feel like that's actually holding that water back, creating a larger wetland area than what originally potentially was there. And so we have been in conversation with DOT about what they can do about that particular part. Of course, placing a culvert under a state-maintained highway is not something that we can readily do ourselves.
Well, I think you're right on your analysis, simply because there's one area there where they did have to replace the pipes. That was when I first got elected in 2014, where it flooded out so bad their man drowned it in that area, in that water sewage area there. So that's something I think that we're going to have some more study on in order for us to resolve those problems. And because seeing that standing water just riding through there, and I went in an area along with you and I both went in an area where that water was standing in those people's backyard. And I had one of the constituents to call me a couple of weeks ago, and she was wanting to redo her floors in her house, but she didn't feel that well, she felt that she needed to wait to see what you all were gonna be able to do to stop the flooding in that area, because that
Right.
water was going up under those citizens' homes, pushing the boards up in their houses. And also it caused those citizens to have health problems with mosquitoes and snakes and all that stuff. So I want you to know how much I appreciate what you have done, but there's still further work to be done. I've been working on this for a long time, and I just got these people on this board here to understand and to address the issue. Another thing is removing those tires. That was a huge job. But what do we do to keep this from happening again in those places?
And that is an excellent question. I think some signage in that area, of course, signage doesn't stop people, but I think it is a good reminder. I think that the community, and I'm sure that they already do, but I think some monitoring by the community is certainly would be a beneficial tool in this situation, that if they see it, to certainly report it. Of course, our office, in partnership again with Solid Waste, we're helping to facilitate the Keep Harnett Beautiful program, and we have a close working relationship with our environmental officer with the sheriff's office, and so some heightened monitoring by him in that area when we have reports. If dumping continues, the dumping that occurred in this area from these tires, it was certainly not recent. So I don't think this is a popular area for dumping at this point. Now, there's not to say that there's not some neighborhood trash that winds up in the area, but I don't think it's a road that the general public generally drives down just to throw out their bags of trash that they don't want to take to a convenience center or to the landfill. There are homes up and down both sides of this road, and so there are eyes there. It's not like you're going to a dead end where nobody lives. There are homes on both sides of this road, which I certainly think will help to deter any potential further dumping there.
Well, I appreciate your analysis of that, but I have one more. Education.
Sure.
I think you and I have been in that community on several occasions, because they they are one community that have an awesome community committee.
They do.
They do. They're well educated, and those people respond when you go and talk to them. I think it's a responsibility of me as that being part of my district, and as of you, to go down and meet with these committee and give them a special report on these tires and whatever else we need to do. So all this money that the county is spending, we hope to resolve this. We don't know if it can be resolved, but they need to be educated as what has happened.
Right. And we have been to those community meetings several times leading up to this point, kind of keeping them in the loop as in terms of what we were planning in the research process. And then when we figured out the locations, we again went to a couple of different community meetings to communicate with the citizens and landowners there. And so we'll be glad to go and give another update and provide some further education.
Thank you. I appreciate you. Appreciate the work that you've done.
You're quite welcome.
So, do I understand it now that all the tires were on the right of way?
No, sir. They used a lot of the tires were on the right of way,
Okay.
but not all of the tires were on the right of way. But they certainly used that DOT, the unused part of the
Right.
DOT right of way, where the pavement stopped. The DOT right of way did not end. It looked like that there was a plan to potentially connect the road to another road that
Right.
was on behind it,
Um,
and that paved connection was never made, so it had grown up.
Have y'all recreated the ditch? Is water flowing now?
Sir?
Did y'all recreate the ditch? Is water flowing now?
So we opened up that ditch where the blockages were occurring. There is very little slope to the land
Sure.
in this area, so the ditch is reopened, but water flow is still very slow just simply because of the flat nature of the slope in the area.
Okay. One other thing, Ms. McCoy, the area there on Bun Level Irwin Road flows down and crosses under 217, just
Right.
there at Titan Roberts Road. They're in the process of replacing that culvert and built a coffer dam there, which has raised the water level in the swamp. But hopefully they'll be done with that in another month. They're-
I'm proud of the work that you have done so far.
Thank you.
Thank you.
All right. Any other questions?
Ms. Lambert, if I might follow up a little bit on Commissioner McCoy's question and subsequent discussion. So I think I understood you to say that there really is not a lot of evidence of other dumping that's going on now and continuing. This is something, the tires especially, something from long ago. Okay.
Yes, sir. And there was very little other
Very
trash
good.
that we found in that area. That what we did find that was not tires was associated. We found the machine that was used to dump the tire, to cut the tires, and we found some, car parts and things of that nature, which we filtered out and hauled off separately. But there was not, residential household trash being dumped in that area. No, sir.
Very good. Should that become a problem, I think there's probably some other options we could have to
Right.
curtail that. The only other thing I would ask is that at the next update, if we could have some after pictures of what it looks
Yes.
like since the tires have been removed. And with regard to the culvert clean out, damage, drainage ditch clean out, some before and after pictures of that as well. I would
We
appreciate
will.
that.
At
Thank
the
you.
next update, enough time will have passed where he will have finished a few of the culverts. And the tire area was just finished, so he's grassing that. And so we'll have time for the grass to be established in that area. That looks like a new piece of property.
Great.
And
Thank
so we'll have time to have pictures of those for the next update.
Anything further? Any other questions? Thank you
All right.
very much.
Thank you.
Update on opioid task force, Mr. Christopher Appel.
All right. Well, good morning, Mr. Chairman, members of the board. Hope everybody's doing well. Melissa, I think the stars may align with everything that's on the agenda. I'd like to take the opportunity to thank Ms. Swift for her service and everything that you have done for Sand Hills and Harnett County, and wish you well in your retirement, Mr. Ward. I look forward to working with you and Mark and the Good Hope Board. Thank you for all that you do for our county. So that kind of leads into segue of what Chris and I want to do is co-chairing the opioid task force to give you an update on kind of where we're at, what's been going on, and then the future plans for Harnett County. So first of all, let me start by talking just a little bit about reaching rural. You've heard us mention that numerous times. What is it? How does it work? And what is it doing for our county? So Reaching Rural brings together rural practitioners from different professional backgrounds and communities throughout the country to build a national network of rural communities committed to adopting bold solutions to the persistent challenge of substance use in rural communities. So Harnett County was very fortunate to be accepted into this inaugural class. It's a one-year inaugural class that started in December of 22. North Carolina, Tennessee, Texas, Arizona, California, Washington State, and Minnesota were the states, the counties that were selected. We were one of 8 counties in the whole entire United States that got into this inaugural class. So we are very excited about that opportunity to work with Reaching Rural as far as this initiative is concerned. So who is on Reaching Rural? So we a very extensive application process was put together. Chris and I are co-chairing the event. Jeff Armstrong, the captain of the Harnett County Sheriff's Department, is on this committee. John Rouse, our health director, is on this committee. Jermaine White with Harnett County Schools is on this committee. Mark Morris with Good Hope Hospital, as well as Dr. David Tillman with Campbell University. So the 7 of us are the ones that are going out to different areas. We just got back from Loudon, Virginia a couple of months ago. We'll be going to a rural part of western Massachusetts in a couple of weeks to look at a jail system that's supposed to be one of the most dynamic jail systems in the country as far as their MAP program. Chris and I will explain that a little bit more in detail about where we're at. So obviously, as you know, This is a dynamic problem. It's a large epidemic that that demands a methodical strategic plan. So that's what Chris and I are going to kind of tag team here today. We're going to explain to you where we're at, how we've come to this point, what the task force is doing, how Reaching Rule comes together. And the cool thing about what's happening with all the organizations in Harnett County is that we're coming together as a team. And we are rising up to what's the best thing to do for our citizens of the county, because every county is different. Every state is different. So Commissioner Weatherspoon and Commissioner McCoy sit on this committee as well. And so Chris and I are going to kind of tag team here, and he's going to talk a little bit about the next steps as far as the monthly coaching sessions.
Okay, so as Nicole mentioned, the Reaching Rule. Part of this are monthly coaching sessions with individuals with this program. The 7 of us get together once a month, come together here and have a Zoom call. And that's an opportunity to just be able to discuss where we're at on our task force, and be able to ask questions of them to help us guide us through this process, ask questions of what's available, whatever maybe steps we need to be taking. Actually, tomorrow is our next monthly, or is our April meeting, and the purpose of that meeting is to give an update on our last task force meeting, which we had last week, on our planning process. So we'll have an opportunity to ask some questions. We're at the point we're going to need some assistance since it's such a big issue. So this is why Reaching Rule is so great, because we have these coaches with these federal programs that help us guide us through this process. The in-person site visits are 3 throughout the year. As Coley mentioned, we've already done the one in Loudoun County where we all came together, got to hear from all these other counties about what they're going through, got to learn about other organizations that provide funding and some technical assistance. It's amazing actually how many different federal organizations do provide money, and how much money is out there. So that's an exciting opportunity. And then to finish out this program at the end of the year in November, December, we're going to go back to Loudoun County and wrap everything up. And we'll get, obviously, as time goes on, we'll get a better idea of what that meeting will be about. So the coaching funding opportunities, which I've mentioned, again, it gives us people who do this on a daily basis to be able to ask questions and get some guidance. I mentioned the funding opportunities. There's a number of different grants. Like I said, there's got SAMHSA, there's USDA for housing types of projects. There's just a lot of different entities that can provide some funding. Now, the key in that, though, is you don't just go ahead and apply and see what you can get and see what sticks up against the wall. You have to have a formulated plan, a general plan of what you want to do before you start applying to these things. So that's part of this process when we're developing our plan to tackle this is putting together these programs and then seeing, can we plug the funding in with a grant, or does it need to come out of our opioid settlement money or something else? So as we develop this, we'll follow along with all the grant opportunities out there and see if we're ready for that, and then maybe we can apply to one of those.
So basically, what Reaching Rule can help us do as we formulate the strategic plan that Chris and I'll go through in just a minute is help fill those gaps, as he mentioned, with all the opportunities out there. And when we sit down with all the folks all over the country, we do learn a lot about what they've done, what they've been up against, and success stories that they've shared as well. There's been one, a rural county that actually bought a hotel in a rural area and made this into a safe haven for opioid addiction. So it's just kind of interesting to kind of hear some of the stories that they've done throughout the country. So that's why it's so important and so key. And the timing of this has been perfect as far as coming together as a group. So this started off fairly slow as far as we call it the Opioid Task Force. I think that's a great name for that. Commissioner McCoy and Commissioner Weatherspoon were heavily engaged in the process, the start of this. So who is actually involved in this? Who sits on this committee? Well, it's rose to about 30 plus members now, which the more the merrier for us as far as hearing the concerns and kind of where we're at in this county. Harnett County Administration, the commissioners, Campbell University, a tremendous asset. We've already had Dr. Agnello come and give a presentation a couple of weeks ago, did an excellent job with that. Dr. Tillman has been a catalyst for us as far as putting the strategic plan process together. And I just can't say enough about Campbell and the tremendous asset that they've been to our community. Emergency Management, Health Department, Social Services, Board of Education, faith-based organizations. We have a number of pastors on this committee that are really starting to share a lot of insight of what we can do with mentorship, accountability partners, and how they can help. Our whole goal for this task force is to break out into small groups eventually and go out in the community and make a difference, and that's going to come through part of this strategic planning process. Mental health treatment facilities, Sand Hills has been a tremendous asset. Good Hope, with Mark sitting on the Reaching Rural Committee, it's really helped us. Drug treatment facilities with Daymark. And there's a couple things as I looked at this that I just felt with Reaching Rural that I've seen and heard. So now we brought in some recovering addicts, and we brought in some parents who've lost loved ones through addiction. And you talk about a powerful testimony, just listening to that and understanding what they've gone through and how they can help us rise up and get to the point to where we need to be for helping the citizens of Harnett County. So Chris is going to talk just a little bit about the litigation settlements, just to bring you an update on that, and then we'll move forward.
Yeah, so just as a reminder, as everyone's aware, we had the first settlement funds which were awarded, which gave the county $6.3 million that's going to be payable over 18 years. The first 3 years or so are going to be, you get a little bit more money than the last years, but so far we have received 2 of those payments. Back in May of last year, we received about $244,000, and in November, another $262,000. So we do have those funds off to the side right now. And as we develop this strategic plan, we'll be able to plug in where we want to best use this money. And then most recently, there is another settlement that's coming through. This does involve a lot of the pharmacies, such as CVS, Walgreens, Walmart, and then a couple other manufacturers, distributors. The exact amount coming to the county is not quite known yet. So as you all are aware, we had to sign off on entering into the settlement agreement. We'll get more details, but what I can tell you though is it's about $750 million coming to North Carolina. It'll be broken up in the same way as the first settlement, so 0.988% to the Harnett County, which will be roughly $5.1 million. Again, when I have more confirmed numbers, when that documentation comes in, I'll report back. But we're looking at another $5 million. This will be paid out a little bit differently. It will be over a total of 15 years, but each entity is paying over a different course of years. So some are paying over as short as 5 years, others are paying up to 15 years. So the way the money will be paid out will be structured a little bit different because it will come in waves, in different amounts. So, and that's great. That's going to be over $11 million coming to this county you can spend. Now, we have to be smart about it because it's $11 million over 15 to 18 years. And a lot of these things to tackle this epidemic is very expensive. And so this is not going to be enough money to solve this issue in Harnett County, but it's enough to get you plug in some different areas of need that we have, and hopefully fill in with grants and maybe some other opportunities. So it is great, but it is a reminder that this is not going to be nearly enough to do everything that we want to do or need to do.
So with that being said, we recognize those efforts as far as short-term goals, long-term goals, as far as sustainability. This thing is very dynamic, and it's like a web. And when you break one part of the web, it affects something else. So that in just a minute, we're going to go through and clearly define 16 different topics that we have been on a listening tour over the past 6 months to kind of see what the issues are and how we can sustain that. It does sound like a lot of money, but over 18 years, you got to make sure you're doing the right thing. So we're looking at it from 3 different methods: primary, secondary, and tertiary. What we can touch right now, what we can get to in the next few years, and then you want to look back over the next 5 or 10 and hope you've made that right decision. This strategic plan can change. This is not set in stone. This is something we're going to look at every year. So with that being said, as you see on your screen, this is what we've heard over the last 6 months as far as issues in Harnett County. And Chris and I, in just a minute, if you'll bear with us, this is very important. We want to clearly define kind of where we're at and what each of these are. Drug treatment court and detox center has been at the top of the list. Obviously, that's very expensive, very hard to sustain. That's something that we're looking at through filling the gaps with other grants. Faith-based initiatives, Commissioner McCoy and I feel like that is a big step as far as getting out in the public and having accountability partners and mentorships. The MAP program, we are very medicated assisted treatment. We are very big on that with the Sheriff's Department, working hand in hand with them. We'll talk a little bit more about that. Housing and transportation are big issues. Big issues. We do have some good news that we got on transportation that we think we may be able to plug some gaps in there. Early youth intervention and peer support are key. Reentry, how do you get the folks that are addicted out of the jail and back into society as far as in the workforce? So we've got some things that we're looking at is there. The LEAD program, Chris is familiar with that. We'll talk about briefly. Syringe service programs, family support, community paramedic, post-overdose, co-located case management, and healthcare access. So please just bear with us a little bit as we kind of define this, and please stop us at any time if you have any questions, concerns, or comments. So let me start with the first one. There it is. Sorry about that. All right, drug treatment court provides an alternative to jail time for those suffering with substance use disorder and who have committed a felony where they may receive rehabilitation, counseling, and job placement. Obviously, as we go through our strategic planning process that we just had a meeting on last week, we did find that drug treatment and detox center was at the top of the list. And that's something we're going to look at as far as the funding is concerned. But as I mentioned, what is the low-hanging fruit that we can address right now? So we'll talk about that as we go through here. Detox center, inpatient treatment facility necessary for patients who are experiencing acute or severe SUDs, which requires more intensive and frequent medication attention. It allows patients to focus solely on recovery and disrupts behavioral patterns and environmental triggers. Faith-based, I mentioned that. Majority of current substance use prevention programs involve faith communities. Study has shown that faith is a positive factor in addiction prevention and recovery with very limited risks. You're probably familiar with the 12-step program about how that works. I feel that that is a very big need for our community and getting our churches, our pastors, and mentorships and accountability partners in gear for that. The medical assisted treatment, we are looking very hard at that right now. Other grant opportunities that are available that the Sheriff's Office is working on right now. Captain Armstrong is heading that up. That's use of medications in combination with counseling and other therapeutic techniques. So you'll hear a whole lot more about that. Housing and transportation obviously go hand in hand. Transportation is a very large need right now. I'm talking in Sand Hills when they have to go out to Asheboro, that is the nearest treatment. When somebody is ready to go, you've got to be available to get them there. And obviously this doesn't happen from 8 to 5. So we are looking at other alternatives for that, even with different Lyft and Uber and things of that nature as far as kind of where we stand there. And then you have the early youth intervention. ACEs impact children from adolescence through adulthood and increase the risk of engaging risky behaviors such as drug use, alcohol use, smoking, etc. Commissioner Matthews, it's been real engaging to hear what Jermaine has talked about as far as what's happening in the schools, and it starts with the vaping. It starts in early stages, and it's really key, and it's a big benefit that he has been a part of this because really the school system has not been a part of the reach and rule, and they found that very intriguing that we had that as part of this program. I know you've been in the school system a long time, and you can speak heavily to that as far as what's happened over the last 3 to 5 years will blow your mind. So that's one thing we're looking at as well. Peer support, so key. People who share similar experiences are more likely to trust, relate, and cooperate with one another. Peer support specialists will be important to this to help establish a trusting relationship and giving what that person is going through. We are very big on that, accountability partners and mentorship. And then employee reentry, as far as the workforce outcomes after incarceration. It allows people to maintain sobriety and have a life after recovery.
Okay, so just, continuing on there, so law enforcement assisted diversion or LEAD program. Now, this is basically a precursor to drug treatment court. So drug treatment court is you've been charged during the court system and trying to resolve your case by being in drug treatment court. LEAD is at the arrest stage. And so what this program would do is it's a pre-arrest diversion program for low-level offenders. Again, this isn't, you're not involving felonies or harming other individuals, assaults and all that, but this is just your individuals that are picked up off the streets and put in jail. So the idea behind a LEAD program is that the individual is picked up and instead of being charged, they can agree to go to treatment. And so long as they're successful in that, the charges will never be brought against them. Now, if they're not successful, then they would be charged and go through the normal court process. We're going to learn a little bit more about that. Fayetteville PD is involved in the LEAD program. we have an opportunity to go to some of their meetings here. I'm trying to schedule that, but hopefully Coley, myself, and Captain Armstrong can go and get a little bit more research on this. But that is another potential diversion program, and it helps keep individuals out of our jail, gets treatment right away. So we feel like this could potentially be a good program. Syringe service programs. Syringe programs are any type of harm reduction initiative aimed at effectively reducing transmission of bloodborne diseases like HIV, HCV, and hepatitis B, and other prevent other infections. So these types of programs just assist in the safe disposal of needles, which removes hazards from the community. Family support services and education. So a good example of this is not about drugs program. It's a universal program that addresses youth substance abuse with emphasis on prescription opioids. The FDA also has started a new campaign to educate on the proper disposal of prescription opioids, and then just other support services to families that are going through opioid addiction issues with their family. Education, awareness, and social marketing, again, kind of similar to the family support services and education. But again, the idea behind education services is to provide opioid and fentanyl awareness initiatives, safe disposal of medications, and so on. And as Coley's mentioned, is Dr. Agnello graciously gave his time for free to already put on one educational program. We're hoping to expand upon that as we go through this. Community paramedicine. So literature has shown that community paramedicine has been well received by community. It's perceived as a source of continuing medical education and accountability by the patients. So in general, community paramedics focus on providing and connecting patients to primary care services, follow-up care, integrative services with local health agency systems. So it's, they get picked up by paramedics, and then they take in the hospital, and that's it. Community paramedicine helps ensure that these individuals are connected with the services that they need. Post-overdose, post-fatality response team. So similar to community paramedicine, literature shown that a goal of an overdose fatality response team is to engage with survivors post-overdose, engage them and link them to treatment and recovery services. So this is outside the paramedic realm, but same idea that it's connecting them with services after they've OD'd. So obviously very important. Co-located case management. The co-located collaborative care model involves one or more mental health professionals who are integral components of the primary care team and who can provide assessment and psychological treatment. So this basically integrates a case manager with a primary care team to allow for better communication and coordination for treatment. So again, making those connections and ensuring accountability. And then healthcare access, medical resident healthcare provider training program, and psychiatry program expansion. So in order to reduce the stigma, increase knowledge about OUD and its treatment, provide more compassionate care to patients, providers need to be well trained to better understand the current opioid crisis as well as OUD specific to individual communities. The idea behind this is to get more of our primary care providers to administer medications and treat individuals because there is a stigma there, but if we can get more providers to help provide these treatments, the better it is for everyone. And just before we move on to the next steps, I do want to give a big shout out to Dr. Tillman and his students. His students went around and had one-on-one meetings with not just our task force, but other individuals that were identified that could help in this situation. They gathered all information, and they came up with all this background information on all these 17 items. So I do want to give a big shout out to the students for all the hard work that they did to put this together, because this is very helpful to identify all these potential things that we want to do.
You can go ahead with this strategic plan.
So next steps. As I mentioned, we just had our last meeting last week. And in this, we're starting to really get into the substance of moving forward with our plan. So we had broken up into small groups to identify what we thought was important items on this list. Now, everything is important, but just what is most important, what we want to start pursuing. So in May, we're going to come back together. The goal is to start breaking out in the small groups and to start formulating, start researching our top goals and ideas that we want to do. What's it going to cost? Who needs to be involved? and who part of the group who wants to be involved in that. And then Allie Fouts, our lead, is going to actually help be a liaison between all the different groups to help the communication as we keep building upon this. So, and part of the strategic plan that Coley just hit on is we have the long-term goals, which are going to be things like detox and drug treatment court. We can't get those started overnight. That's going to take time. It takes time to get the program together, and it's going to take time to get funding, and not just get the funding, but how do we sustain those types of things? So we have to identify all that. So those will be part of our long-term goal as we go through the 18 years. And then there's going to be the short-term goals. As Coley mentioned, the sheriff's office is already working on Matt in the jails, which is and the DA as well, working together on that already. Transportation is another thing. The short-term goals to help get people to each individual thing. So we are identifying what will be long-term and short-term, and what we can start accomplishing in the next 60 days to 6 months to start spending some of our dollars or plugging in some other funding.
So that kind of leads us into the next session. Is I would like to call for a public input session for the citizens of Harnett County, and I would love to do that on the night of your nightly monthly board meeting, which is May 15th at 6 p.m. So the citizens of Harnett County would have the opportunity to come and share the input of what they're seeing, what they're feeling, and we'd love to hear from their voice as well. So that gives them an opportunity. So this just gives you an overview. I know this was a lot of information. I appreciate you bearing with us to hear this. Chris and I would love to open up for questions, concerns, comments, or ideas that you may have to help us move forward to do what's best for our county.
Thank you, gentlemen. Any other questions, comments?
Well, I just had one question. Now, Loudoun County, I'm assuming is not part of this 8 county. That's just somewhere.
No, that's somewhere we went.
Has
Yeah.
implemented
Right.
some things that you're
Federal
seeing.
funders right there, so it was a good chance to bring all of them in for a day's meeting.
Most of the funders are in the Virginia, Washington area.
Right,
so
okay. Yeah,
they
makes
found-
sense.
Yeah.
Yeah, if it's not the richest county in the nation, it's certainly one of them.
Exactly. Are you?
Thank you for your hard work.
Yeah, you're welcome. Are you happy with kind of where we're going, the process, and kind of is there anything you'd like to see us change, do different, or just give you frequent updates and give the citizens a chance to speak, and then we'll put these strategic plans together with primary, secondary, and tertiary treatment?
Good.
Okay. Thank you for your support.
Thank you very much. Appreciate all the hard work you guys are doing.
Good job.
All right. Well, Mr. Appel, I'm going to keep you up here.
Okay.
We're going to discuss the revocation of the offer to sale for Monroe Lane.
Yeah, so Commissioners, if you recall, we were approached by an individual that was interested in purchasing a piece of property off of Monroe Lane. She is immediately adjacent to this piece of property, so she put her offer in $14,520, which is the tax value of that parcel. We didn't have a need for this piece of property. We've had it for decades, no use for it. So we started the upset bid process, and Ms. Pamela White had put down the $726 as a deposit as required. You all adopted a resolution to begin that upset bid process, and then no other bids were received by the deadline of October 24, 2022. And therefore, Ms. White's offer was accepted for the $14,520. Now, Ms. White was given a deadline by March 15, 2023 to pay the remaining balance. I know there were some issues that came up, personal issues as to why she wasn't able to pay at the time. But as of today, we still have not received the final balance, and so I'm going to be requesting revocation at their next meeting of the offer. We would keep the deposit. She forfeits that deposit money. Now, as of yesterday, we did get a call from Ms. White saying that she planned on paying by the end of the week, and that's great. If so, we'll pull this from the Monday agenda if she does pay, and we'll deed over the property and record a deed to giving her the property. But if she doesn't do so, then I would still be asking for the revocation come Monday.
Thank you. If it's the pleasure of the board, can we put this on the consent agenda?
Sure.
That stipulation. Good, Lou? We'll add this to next week's consent, Madam Clerk.
Okay. Thank you.
Thank you very much, sir. All right, compensation study update. Ms. Janice Lane.
Good morning. We are excited to present the final report for the compensation study. So if you guys remember, this was a part of the strategic plan that was adopted by the county last year. And we put an RFP out in November. Pontifex Consulting Group was selected from the RFPs received. We started our meetings at the end of January and met with all of the department heads to see what the concerns that they had. And we received the final report a couple of weeks ago. We've had it for a couple of weeks to kind of study that and make sure we understood what was in that report. And then we needed finance's help and our budget director's help to look at the numbers and the percentages to see what impact it would have on the county's budget. So with that, I have Pete Ronza here. He will cover his report, and then I will come back up and give recommendations from the HR department.
Good morning. Thank you, Chair, members of the board, for allowing me the time to be here today. You received the report. I just want to do a brief presentation just to walk you through the issues, and of course at the end answer any and all questions you may have in regard to that. I got the clicker. Oh, I love when I have control. Here we go. Just to explain who we are, and again, we submitted an RFP with all our resumes, et cetera. We've been in the business for a long time. A lot of experience public sector all across the country. Also here in North Carolina, we just completed recently a study for your neighbors over at Cumberland County. We were just contacted by Haywood County on the west side. I'm getting my North Carolina geography down pat now. But we have clients all over the United States, same issues, same kind of study that I'm going to walk you through. And what we do is we provide customized service. So we don't have off-the-shelf products. We get to know you, as Janice says, meet with you, get to know you and your jobs and how you do business so that we can make sure that you get the right study. I want to explain what a compensation system is, especially the importance it has for you, because you're a service provider. So it's especially critical for you. As you provide a service, you need the right people with the right qualities, with the right qualifications. And it's your largest fixed cost. So it's especially critical from that perspective that you are aligned to the market. So what a compensation system does for a living, it just does two things. It attracts and retains. So that's critical for you to take into account. And there's really three elements I'll walk through: the internal of making sure your job descriptions are accurate. They have an internal hierarchy that you know how you allocate worth internally, marrying that together with the external market so that you have pay ranges that are appropriate to match that so you can attract and retain. And not sexy, but incredibly important, and I'll explain that, the process equity. A compensation system is not static. It's vibrant because your labor market is vibrant, your workforce is vibrant, and the demands on you to provide service are vibrant. Therefore, it has to be maintained. Think like your car. You got to change the oil, you got to check the air in the tires. If you leave a compensation system alone, it's going to not go well. Just had a client, unfortunately, they haven't done this since 1987, and we'll be okay. We'll drink heavily, we'll be fine. But it's really, really important. I'm going to explain that process because we also, as part of our contract, make a commitment to support you free of charge so that when your staff have issues, when they have problems, because inevitably something will come up, as you have questions, they're going to be able to come to us. We'll be able to support you, and you can move on, and you don't have to worry about things falling apart or things going left or right. So, and it's just that balance of the two, because they're both important. What we were tasked to do is provide that analysis of where your competitors, and I'll explain in the compensation system what I mean by competitors, are doing, find out where you are today, where they are, and then recommendations to get you to that point where you can attract and retain. Some recommendations for the process equity. Make sure we're aligning with your compensation philosophy and strategy. Every organization has one. Think of it as the the basement, the benchmark, the foundation of your house. It dictates everything. And of course, fiscally responsible, whether you're private or public, you're never going to have all the money you need, but you have an extra burden and an extra responsibility, and that you have to make sure that you account for these funds and that you're responsible for the use of those to attract and retain labor. Our labor market analysis, what is that? It's looking at the jobs, and I want to stress here, we look at jobs, not people. How you pay people within those jobs is a whole different process. But what we have to create is a system that gets the minimum and maximum value of a skill set, that skill set that you employ, so that we can make sure that you can attract and retain. For the reasons, some of which we've already explained, but especially in this labor market, to align to that. The labor market was already very volatile before COVID. It is now completely insane. And this is across the country. Granted, it varies by skill sets. There are certain industries that are feeling more pain than others. Supply and demand is a big factor of that. But COVID has also readjusted some of the mixes in the market and reallocated some of the workforces across the country. So it's causing additional stress, additional considerations, additional movement on the part of employers to, and again, make sure they can attract and retain labor to provide the service they need to. And I want to stress this and make this completely clear, and we had great meetings with your department heads. Purpose of this study is to value your jobs, to provide that minimum and maximum value, not people. That is something you do. But that last bullet point is very, very, very important these days, supply and demand. The labor market's all about supply and demand. The labor market, no offense, doesn't care who you are. It's going to say, if the county manager were to call me and say, Pete, we need to hire a web designer. Here's the description of the job. Could you please go out and price that? And I will provide the county manager with that information. The county manager will have three choices to make. It's like if you go to the store and buy milk. You know, there's one price for milk. That's what it is. So you either buy milk, don't buy milk, or you buy a cow. He will have three decisions. Okay, this is what we need for a qualified web designer, which we have decided in this organization is critical and we need to have that. No, we really can't do that. We'll find another way to do that, or we'll contract it out. Normal decisions any employer will make. But the market, I want to stress, does not have different prices. It will give you the information, and then you take that information and make the decisions for your organization based on that. So just to stress that. I like to throw out, it's good to know what the temperature is outside. And thanks again for allowing me to come to North Carolina, where they have that thing called the sun that's out in the sky. I really appreciate that. But this is really important lately. Usually this is a boring slide because CPI, that's the Consumer Price Index, which is on the left side of the chart that you see on the screen, is pretty static. It's pretty boring. But as you know, these last couple of years, it has been volatile. But I want to draw your attention to the ECI, which is also a statistic put out by the Department of Labor, and it measures, for lack of a better term, labor inflation. And so what it's tracking is the cost of labor over a period of time. Most organizations, CFOs love this number. When they're thinking about budgeting, when they're thinking about trends, we'll look at ECI because ECI reflects the movement of labor. And as you can see, the movement of labor is methodical. The movement of goods, the CPI measures gas, salad dressing, clothing, tires. Sorry, I had to pick on the tires because you had that. It's an important number because I'm not going to look an employee in the face who is going to the grocery store, looking at the price of goods, having to fill their gas tank, and look them in the face and say, CPI is not important to me, because it's very important to them. But as an organization, you have to temper that by looking at what the movement of labor is. So I want to show you all those over the last 10 years so you get a good feel for how those different markets move. And of course, I appended to that, your staff was kind enough to give me the numbers so that you can see your trend. Again, the more information you have, the better you can make decisions, and seeing those trends and seeing over historical basis how you're doing and how the market's doing. And I apologize, I'm a labor economist by trade. I'm going through therapy. But it's also important to see what's going on right now, especially since we don't know. We see starting to cool in the labor market, but we don't know. how that's going to work. And of course, inflation, we have no idea. But what's really important for you is that quit rate, is that there are a lot of organizations in this market that have no hesitation to write a check to steal talent. Because if I can get somebody and just write a check for $10,000 more and they know what they're doing, they've been in the profession or their trade for a while and they're good to go, that investment is worth gold. The labor market where I live, that is the number one concern. Attraction is not the concern, it's retention. So we monitor these, we look at these as an employer. This is why you want to keep your eye on the market, like looking out and seeing where things are going, and then making those decisions as you do as a board to make sure you can and have a program that allows you to attract and retain, like your competitors are doing. As a result of the study, and this is an aggregate of where you are, this is not dissimilar to how pretty much everybody across this country has done a study since COVID is. The bottom figure is very typical because the one thing that has happened since COVID is the bottom end of the market. And by the bottom end, I mean more of the entry-level jobs, more of the jobs that are what we would call the minimal wages, have gone up at a much more accelerated rate than historically due to a combination of factors. Regulations that have increased minimum wages and the movement of the market. There's a lot of people who have moved out of that market, moved to other jobs, and not come back. And I'm sure you're all familiar, you read the stories, I don't have to tell you, about retail establishments, et cetera, who have had problems with this. So the bottom end of the market is where we've seen the most volatility. So where you're at is not unfamiliar. It's not that far either, but it's pretty typical of the volatility that we've had since COVID. Where our recommendations, and your staff, of course, will follow with their suggestions after me, is to increase your salary ranges by 5% on your 7/1/23 fiscal year. This takes into effect where you are, and it'll give you some breathing room for the year or so coming, so that again, you're within that sweet spot at being level with the market. So you should have, from a wage perspective, no problem attracting and retaining. I say that on purpose to say, obviously, there are other reasons people join organizations. There's branding, who you are, where you are, etc. But we want to make sure that we cut out the one thing you can control, and then you can work on the other things. We support, based on the stats out in the market, the recommendation your staff is going to make for a cross-board increase for your staff of 3% on 7/1/23. We're also recommending the $15 an hour minimum wage in your next fiscal year. The reason we're recommending that, based on our analysis, is not only your private and public competitors moving that way, because again, as I explained, I'm sorry to be repetitive, that part of the market has moved, but we just finished a study for Cumberland County where they did move, your neighbor did move to $15, and we know that some of your other neighbors, if they're not already there, they're gravitating towards that, So this gives you time to be able to adapt and improvise and adjust to that so that you can be nimble. And we gave some from an internal perspective, although we just did a comp study, we saw some things in HR, and we can certainly help them with during the next fiscal year. They can look at that internal equity. There may be some positions over the years that just have to be relooked at based on our conversation with your department heads, and this will give HR time to do a nice in-depth analysis and look at that and see if there has to be any changes or movement. Process equity, like I said, very important for me because this has to be vibrant. You don't want to just do this every 4 or 5 years, let it break, fix it, let it break, fix it. So, we recommend you monitor the market. This will avoid salary compression. That is the cancer that kills compensation systems. And what I mean by that, I apologize using the technical term, salary compression is when one level of job either matches or supersedes that of its supervision or the next steps. We have a huge problem with that nationally lately in public safety. Where you have one group, let's say, that's unionized or has a different salary system than the management staff. And if you don't pay attention to that, unfortunately, your talent may not see a reason to then progress to command or to management. So you don't really have a problem, but making sure your compensation system is aligned to the market will help you that. And of course, legal compliance. We're seeing more legal initiatives, both on a local and federal level. And as I said, we're on the hook for a minimum of 1 year free of charge to support your staff. So if we see any legislation come out, anything regulatory, be more than happy to help your staff with that so that they can come to you and explain how they have to make any adjustments and why they have to do that. Happy to do that for you. And so now I'm just going to be quiet and let you ask any and all questions while I'm here.
Thank you very much, sir. Anybody have any questions? Comments? Nothing? All right.
And I guess I'll hand it back to Janice.
Okay, so the recommendations, we have three parts from the HR department. So the first one is to approve the recommendation to increase the public safety positions by 10%, and that would be effective May 16th of 2023. That would include, the 10% increase on May 16th would apply to the sheriff's office positions that did not receive the two-part market adjustment on November 16th and March 16th of 2023. This also will include the frontline emergency service positions. So the total impact for that would be, looking from May 16th through June 30th, is $122,221. So I had Lisa pull those numbers. So that's what we're looking at, and that would come from fund balance. And that is salaries and benefits. That's the total number for that. So the second piece is to approve the recommendation to increase 8%, to give an 8% increase to all county positions effective July 16th. The impact for that will be $6,673,890. So $6,673,890. That is going to be included in the next year's budget that you guys will see probably in the next week or so. So that will be included in that. And then the third step is for the next year of 2024 and 2025, and that is to adopt the minimum minimum wage of $15 per hour, and that'll affect pay grades 1 through 13 currently on that pay grade scale, and that'll move everybody up to $15 an hour. The second thing is, under Part 3, is to examine any job classification that shows a greater than negative 10% to ensure that position is graded properly. And that is in those pages probably 7 through 37 of that final report. If you see all of those where it looks at the min, the midpoint, and the max, and you'll see some negatives over in the far right-hand column, and we would take a look at all of those. And then, of course, the last thing is to review this every 24 months because, and unfortunately, as Pete said, as we're doing this, all of our surrounding counties are doing it as well. I get phone calls weekly for them asking questions from other consultants. So everyone who's touching our borders is doing this as well. So we have to feel like we're feeling like we're having to stay two steps ahead of the other counties. So any questions on those recommendations?
I do have a question.
Okay.
You had mentioned the increase for the $15 an hour for pay grades 1 through 13. Do you have a dollar amount on the increase and what that's going to look like?
I don't. We did not put that number together because we knew that was going to be 24, 25
Gotcha.
year. Yeah. But this is helping. If we're moving everyone 8%, right, and if we do that July 1st, then that's going to be helpful with that. So we don't have so far to go.
That number will eventually get calculated once we've completed the 8% increase, and then we look at the next budget year. We'll have a number for you to be able to show you what the cost will be for the move to $15 an hour in next year's budget.
Yeah, and any of those positions that are greater than negative 10%, we'll have those numbers as well.
Any other questions? Comments?
So the one thing that I'll add is that, so as she mentioned in the recommendation, the one item that we'll need to have the board consider approval for on the May 1st meeting is to move all those positions from public safety that did not receive the 10% increase already, to move them up to 10%. We want to implement that at this time so that when we get to the July 16th payroll, assuming the budget's approved for the 8% that's mentioned, everybody will already have been moved from the public safety side of it to their new salary, and then they add 8%. So really what we're looking at is many of our public safety, EMS, law enforcement folks are looking at an 18% increase here that we will have provided them in a period of about 6 months, or I guess 8 months. So that's, one of those things you look at, that's a large number. But if you look at it, that's our biggest issue we have for recruitment right now is in our law enforcement and our emergency medical services. So this is why that's warranted. It really is an area that we cannot afford to get behind on in order to be able to stay competitive.
And this is what you need the 122,000 for.
Right.
Yes, sir. And that's also going to help with a little bit of the compression between the sergeant and lieutenants, because for detention and deputy sheriffs, we increase those with those 2 market adjustments. But then you've got a lieutenant that's not making that much more than someone reporting to them. So everyone's going to be shifted up, hopefully.
You said we got to make this decision by May the 1st?
Yes, we would look to do the additional 10% for public safety that did not receive the 10% previously. They would move on May 16th. So we would have this on the agenda May 1st to address those individuals that had not received that 10% increase that are in the public safety area.
Totally understand it, but I know that they are underpaid as far as the surrounding counties and all, but I understand that our own employees here in this county are too. So your recommendation, I totally understand that we did this in 2016. Is that not right, Kim? Had this
The comp
study.
I think it was 17.
17.
It was
I know it was
2017.
one of them, 17 or 16. And of course, we've come a long ways from that particular time, but still have a long ways to go as far as retaining our good employees in here in this county, and that is what is important.
Yeah, and that's why the budget will include an 8% increase for all the other employees. So if you look at employees that have been with us the last 2 years would have received a 10% increase that the board approved prior to my arrival. Then July 1, they received a 3% increase. So we've been catching up a number of those employees, not to mention they've also received, if they received a positive review, a 1.5% increase based on their review. So I think the increase is not as much for employees that aren't in public safety, but we still have been doing a pretty good job, I think, of moving them, and that's evident by the numbers not being any higher based on the analysis that Pontifex did. That number could have been a lot higher had the board not taken the steps that it already has with regards to increases for staff.
But it's a big difference. This report reveals a big difference than they did in 2017. Because if you've seen the report before 2017, it makes hair stand up on your head.
Yes, ma'am. And that was on a slide back here. I believe the 2017 gave a 1% or less than 1% increase to all employees. That was the number in 2017. Yes, ma'am.
Is it the pleasure of the board to add the pay increase for the emergency service personnel, which is an increase of $122,000 that we'd pay out between now and July, correct?
Yes.
Would it be a pleasure of the board to add that to the
Yeah, put that on the consent agenda.
Good with that, Lou? All right, Madam Clerk, we'll add that to the consent agenda for next week.
All right, thank you.
Thank you very much. Mr. Trout, discuss proposed changes to Article 3, the pay plan.
Thank you. One of the other things that we identified as we've been going through some changes within personnel, we've made some internal promotions. And as we've done those internal promotions, we try to make sure that those individuals are kept with the market rate. What we found is that the current personnel ordinance restricts my ability to provide increases at 10%. That is the maximum amount I can increase the salary if a person is promoted from one position to the next internal. If I were to hire an individual from the outside, I can choose a starting rate as long as it fits within the pay scale. So in order to encourage continued promotion from within when we can, we need to look at a change in our policy, our personnel ordinance that allows, our recommendation is to allow a 20% increase to be able to be given in special circumstances by the county manager for positions. In addition, we oftentimes feel pressure where individuals that are with us gain experience and they are sought after by other communities, and we want to have the ability to provide an increase in order to stay competitive and keep them here. So a request to change and allow us to provide a 15% increase to retain employees in positions that we have. And so that's presented to you for consideration.
Is there any objection to making this change in order to allow the county manager to make the increases for 20% on special instances and then up to 15% for other employees for retention purposes? Any questions or comments on it?
No.
Recommendation?
This is something I've been talking about for years.
Yeah, I personally think it's a wise move. When you have talent within and you cannot reward that talent, I think we've got a problem there. So I would certainly support that.
I agree, because as the policy is today, is my understanding, I pick on Coley for a minute. We couldn't give him but a 10% raise, but he could quit when we turn around and hire him back the next day at whatever we wanted to. So I think the manager needs a little more leeway than 10%.
Agreed.
Let him do it on his signature, and if it needs to go in or something he's got a question about, he can always come to us on it.
Well, I agree that he should have the right to make those moves and all, but I think that he should communicate with us too on whenever that decision is, whenever it's time for that decision. I think you should communicate to us, because there have been times when we as the commissioners agreed and it didn't happen. I'm glad to see, and that's one thing I talked to you about when you first came in, is we got to do something to make it right for affordable wage for our employees. And I believe in that for every employee. Kimberly, how does that affect our budget? It's not going to affect it, right? We have to do what we have to do.
Yes, ma'am.
No objection.
I'll talk about it in a minute.
We'll go ahead and add this to the consent agenda for approval.
I just want to say one more thing. The reason I'm pleased to hear this, because we have not been anything but a training bed in this county. New employees come here and get trained, and they're moving on because other surrounding counties' wages are so much higher than ours, and people have to live. So that's all I got to say. That's it, all I got to say.
We will move on to the quarterly finance update. Ms. Honeycutt.
All right, Mr. Chairman, members of the board, I'm not exactly sure how I feel about following all of that, because mine is not riveting at all. So basically, each month in your packages, you will find a monthly analysis of our financial reports of the different funds, various activity, etc. And starting with this fiscal year, getting back after the pandemic, I wanted to come to you each quarter to discuss the county's performance for that quarter, compare that to the prior year at the same time. And I first started out giving you basically performance measurement pieces such as percentages, over, under, kind of briefly talk about what we were doing. So for this third quarter of the year, of the fiscal year, I thought it would be very beneficial as we're going into our budget process, and then to follow up on the presentation by Pontifex and our Human Resources Director about our market study. I wanted to kind of pull out the general fund piece and talk about that. I've given you a handout. It's a front and back one page, but basically what we're looking at is I took the general fund activity from there's a large report. It's about 33 pages. I've taken and summarized the activity on pages 1 through 4 just for the general fund, because the general fund, if you remember, is what I call our operating fund. The sole source of income for that fund is the property taxes that you have the authority to levy, as well as sales tax. Now, we do get other service charges for planning inspections, those types of things. We also get federal grants and awards from state and federal for some of our various departments, but the major revenue source is the ad valorem and the sales tax. So what I did was I actually took your ad valorem taxes. Those are usually summarized in that monthly report, but I actually took it for this analysis and broke it out between your DMV, your delinquent, and your penalties to give you an idea of what the budget is and to look at the activity that we have received to date versus what we received last year. And one of the things that I found very interesting is that when you look at the amount of actual revenue received compared to last year, you can see the impact of the revaluation study that was done. I know we reduced our tax rate down to be a revenue neutral. Well, actually, it was just a few cents above revenue neutral, but I think that also really puts into perspective the amount of growth that this county has seen, the amount of residential growth. Those are housetops, but you also know that with that comes, families and children and the need for schools, but also the need for additional services, additional everything else. So we are a county that's exploding. So if you would just kind of take a look at that, and then the second one that I want to discuss is our sales tax. Now, for sales tax, the number that's represented of 14.4 million collected to date, that is only for the first 6 months of the year. I do have the numbers for January in hand, and when I went back and did an analysis for July through January, we are averaging in the general fund around $2.3 million a month. So I just wanted to kind of bring that to your attention. We have pretty much received all of the ad valorem ad valorem property tax for the real property that we're going to receive this year. So the revenue that we've collected now is what we will use to live off of until we reissue tax bills again. So that's kind of our cycle. So you're seeing us at the height. So when you go and look at, I believe it's on page 4 or 5 of that report, you look at our cash balance, because I have our monthly cash balance on there, you see our cash pick up, and then it just starts to dwindle down till we get the tax bills go out again. So, but for sales tax, I just wanted to kind of bring that to your attention again, that is robust. It is continuing on. I know that economists have discussed about it either ticking up, ticking down. Is it market driven? Is it pandemic driven? I think some of it is inflation driven as well, but it still is remaining very healthy. So then I wanted to also bring attention, if you'll look at the second box, to compare our general fund expenditures, and they are listed by the function area. So when you compare, like, for example, the general government, we have basically spent just not quite $4 million over what we did last year. That is a combination in all of those departments. That increase is due to increase of wages that we had talked about. Also, where we have had several vacancies, I think Janice had given us a report a few meetings ago about how many vacancies we had in very key areas. So now we are starting to see, with the increase of our salaries, the COLAs that you have provided, we are attracting more talent, so we are filling those positions. So likewise, we are spending that money on salaries, and we need those individuals to perform the services that the citizens are needing. I will not go into a lot of detail with that, but I also want to point your attention in the area of education. That includes the money that we give to schools as well as Central Carolina Community College. So when you're looking at the actual that we have spent of $20.9 million versus last year of 22.4, I don't want anyone to misunderstand that we're giving less to the schools and the college that we did last year. That is simply, last year was a timing payment. So it's actually, last year has an extra monthly payment. It evened up at the end of the year, but I don't want anyone from the public, when we put these out, to think that we have given less than we did last year. We have not. So when you look at it, we have collected $128 million of revenue, and we have spent 106 million in expenditures. When you compare that to last year, at this time, we had collected 110 million in revenue and had spent 96 million in expenditures. And that, when I first looked at that, I told Alan, gosh, that's, what are we spending our money on? And that looks like a huge swing. But when you actually now analyze it, we have spent 82.6% of our revenue this year compared to 87.4% last year at the same time. And I think that we are moving forward. We've seen an increase in the cost of software, the cost of services that we outsource to pay for. Seems like everything is going up, but fortunately, we've been able to keep up and continue to provide the services that citizens need. So right now, as through the third quarter ending March 31st, the county has collected 22.3 million more in revenue than we have spent. Now, that's a nice number, but keep in mind, that's the kind of money that we will continue to live on through January. We will continue to collect sales tax, but we will start to see that number go down. So each monthly report afterwards, when you start looking at it, that gap is going to decrease. But also to bring your attention, fund balance last year was at 29%. When I went back and did your fund balance analysis when we had our last joint meeting, our fund balance, including what we had appropriated today, our fund balance restated was at 25.5%. So I am looking at moving out some fund balance money. You will see that in some future budget amendments, and that is to go ahead and finance the CIP approved activities that y'all have approved. So that would be the capital maintenance for the schools, that would be the capital fund for the sheriff's department, EMS, those various monies that we have set aside. And what that also allows us to do is to have that money there for next year for the departments as they're spending. So that is part of our money that we are putting aside to spend our money for vehicles, for the things that we know that we need. Because in prior years, as we've shown over that 10-year study that we looked at, we would always defer capital. So by putting money aside, we are ensuring that we have the money to replace chillers, to replace hot water heaters, to do what we need to do. So that's a lot of information. I tried to make it as simple as possible, but on the back side, I also pointed out for you, I spoke briefly about public utilities, and more detail of that can be found on page 11 of that 33-page report, and solid waste. And just to kind of draw attention, Harnett Regional Water's revenues are actually up 4.85% from last year at the same time, and solid waste revenue is up 9.92% from the same time. And one large variance that I saw when analyzing these two departments is that Harnett Regional Water for expenditures has spent 46.9 million compared to 16 million last year at the same time. And so when we went back and looked at this, we have actually Steve has actually transferred quite a bit of money out to his capital projects, because as part of his CIP, he has to identify if it's going to be a pay-go funding or if he plans to borrow money or whatever. And as you've heard him speak earlier today, his money is going to actually pay for this instead of issuing debt. So in an economy like now, with the interest rates going up like they are, that's a good place to be, because you're using your money to benefit yourself. So I just want to kind of point that out to you. Does anyone have any questions? And I hope I wasn't speaking too fast. I could talk all day about this, but I don't have all day, so I know you don't either. So, but I just wanted to say that everything that you as a board and that has been put into place, it's taken us several years to get to where we are today, to be able to have the money set aside with the capital, set aside for the debt, set aside for our health insurance, and all the other areas that we know we have to fund. But that has taken, it's been a team effort by everyone. And when I say everyone, I mean, management, the employees, and you as the board as well, through the adoption of policies, procedures, and really making sure that when you make a decision, it's not just a decision to spend money, it's a decision to invest in our future. And that's a decision to invest in our citizens as well. So, any questions?
Questions? Comments? Outstanding. Thank you very much for the report.
Thank you.
Thank you.
Okay. All right, commissioners, have review applications for boards and committees. You have appointments needed in front of you in your packet, as well as, I believe, 2 applications attached. There's 2 vacancies on the Dangerous Dog Committee. One is a member and one is an alternate. And they are not district sensitive. There is an application for Kristen Jade Stone, like to be appointed as a regular member. She currently serves as an alternate. She'll be replacing Dr. Baker, who no longer is interested in serving. It's out of District 1. You had a chance to speak to this individual, or do you know this individual, Commissioner McCoy?
Or is that now, Mr. One?
Jade Stone.
It's okay. I haven't had a chance to speak to this individual, but I'm gonna go ahead and approve it.
You're okay with that?
I'll approve that.
Does anybody have any issues with that?
Mhm.
We'll go ahead and put Ms. Stone on for next week on the consent agenda for approval. Then we will move on to the Cemetery Board of Trustees. There's 2 vacancies. It's not district sensitive. Della Owens would like to be considered. That's a District 3 application. Is there any comments on this individual?
I'm fine with that appointment, Mr. Chair.
Any issues with that? Anybody? Okay, we'll go ahead and add Della Owens for approval next week as well. Johnson Lee Harnett Community Action. Mr. Gordon Springle would like to be considered for appointment. He will be replacing Ursula McLean as a county commissioner appointee. I believe that we were waiting on his application, correct?
Right.
Okay, so we'll just go ahead and hold off until that comes through. Okay, and then isn't there a time sensitive on that position?
Yes, when we spoke to the director of this organization, she said they would need a full board appointed prior to the start of their new fiscal year,
What is their fiscal years?
July 1.
I want to. Okay, well then we will look forward to that application. Okay. Moving on, County Manager's Report, Mr. Trout.
Thank you, Chair. 3 quick items that I have for you. The first one is, in case you weren't aware of it, we are having an exercise at our EOC today related to a Harris Energy Center type incident. This is important training for our staff to be prepared in case there is such a need. So that's ongoing today, and that is evaluated by FEMA to ensure we're proficient. Second item, I'll be out tomorrow for my second day of Leadership Harnett tomorrow, so I won't be available at the office. Just wanted to let you know I did meet with Reed Williams from the Alliance, and we had a good discussion regarding the details. We've been playing phone tag yesterday and today, and hopefully we'll be able to iron out those last details and prepare an agreement for your consideration in the future. Thank you.
Thank you, sir. And do we have a need for closed session?
No, Mr. Chairman.
Outstanding. I will entertain a motion to adjourn.
So moved.
Are you meeting with
I have a motion to adjourn.
Yeah.
Motion and a second to adjourn. We adjourn.